Sexual Transmission Diseases Prevention in Adolescence. By Giselle Ganchecker, Patricia de la Fuente Lomas and Katarina Stiblikova. Index. First, we are going to talk about what STDs are, how we can prevent them, types of protection, the correct way to put a condom, and finally where to go in case of suspicion. What are the STDs? Sexually transmitted diseases, STDs, are a type of disease that is transmitted by skin-to-skin contact or through sexual fluids. These can be transmitted either vaginally, anally, or orally. Among the best known we find HIV or syphilis. Common types of STDs. Sometimes STDs do not show symptoms, but it is important to recognize them. Chlamydia is one of the most common STDs, and it can cause painful urination, unusual discharge, lower abdominal pain in females and testicular pain in males. Without treatment, chlamydia can lead to serious health issues, such as pelvic inflammatory disease, PID, in females, which can affect fertility. Human immunodeficiency virus, HIV, is a virus that affects the immune system. It can start with flu-like symptoms like fever, headache and sore throat, fatigue and rash. Without treatment, HIV can weaken the immune system and lead to AIDS, acquired immunodeficiency syndrome. And gonorrhea can infect different parts of the body, including the genitals, throat and rectum. It can cause burning sensation when urinating, white, yellow or green discharge, testicular pain and vaginal bleeding between periods. Without treatment, gonorrhea can lead to PID and infertility. How can we prevent them? STDs are more common in the young population between 15 and 24 years old. There are different barriers to avoid them. First of all, the condom that prevents both these diseases and pregnancy and has an effectiveness of 87%. We find both female and male condoms. Another barrier would be oral latex barrier. In these images, we can observe the different types of barriers against STDs. Oral barriers are placed over the area to create a barrier between the mouth and the genitals, preventing direct contact with fluids and therefore reducing the risk of STDs. The female condom should be inserted into the vagina before sexual activity. Unlike the male condom, it is placed inside the vagina and covers part of the external genitals, providing protection against STDs and pregnancy. The male condom is one of the most common and effective barriers when it's used correctly to prevent both pregnancy and STDs. Additionally, it is important to remember that both before and after any type of sexual activity, hand hygiene should be maintained to eliminate germs. Correct way to put on a condom. It's important to follow certain steps to put on a condom correctly. 1. Hand hygiene. 2. Carefully open an envelope that is in good condition, taking care not to break the condom. 3. Place the condom correctly. The edge should be outwards, so that it looks like a small hat and unrolls easily. If you've put it upside down, throw it away, don't put it again. Take a new one. 4. Pinch the tip so that no air enters and unroll it to the base. 5. After use, remove it carefully so that nothing spills. 6. It is important to check later that it has not broken during the act. Where should we go? If a person suspects they have an STD, they should go to a health center or specialized STD clinic, a primary care doctor or a sexual health clinic and lab. There, different tests will be performed to diagnose the STD. The most common tests are blood tests, which are used to detect infections like HIV, syphilis and hepatitis B or C, urinal samples, which are useful for diagnosing chlamydia and gonorrhea, and genital swabs, which are taken if there is a secretion, to detect infections like gonorrhea or chlamydia. Thanks for your attention.
This video forms part of the project fostering cross-cultural collaboration with artificial intelligence in service learning. The project involves the University of Alicante in Spain, the University of Hradec Králové in the Czech Republic, IES Leonardo da Vinci of Alicante in Spain, and Vyšší odborná škola zdravotníka and Střední zdravotnická škola of Hradec Králové, Czech Republic. We would like to thank the READS program for their financial and institutional support, and the company Alicante Training for their technological assistance.